This patient regrets her fat transfer to the breast. So if you haven't seen her video, she talks about having a horrible experience with pain, feeling the liposuction procedure all the way through, and then being left with dimples and irregularities on her abdomen, and then finally also not even noticing a significant transfer to the breast or any change in shape or size of her breasts. So here are my points as a board-certified plastic surgeon. So first of all, you experiencing pain during your awake liposuction procedure is not okay. Your surgeon should have halted the procedure, giving you more numbing and making sure you're comfortable before proceeding. So secondly, she talked about multiple things. Irregularities, which can happen during liposuction, but with proper technique should be kept at a bare minimum, as well as nerve damage, which typically does not happen with liposuction. It is very common to have areas of numbness temporarily after liposuction, and I think you should have been educated about that and informed about that. That is expected, and that typically goes away within a few months after liposuction, and it's not permanent, so definitely don't be worried about that. And then thirdly, you talked about recovery not being fast enough, and again, I think the expectations should have been managed better, in that it takes longer than 2 weeks to be back to fully normal after any invasive procedure, and liposuction is an invasive procedure. And then lastly, she was very sad about the lack of retention of the fat in her breasts. And, it's not 10%, but typically in the breast, in my hands, it's about 50 to 60%, which is lower than in other areas of the body. For example, the buttocks, where people typically retain about 70-80% of the fat. And so typically I over-inject a little bit, knowing that some of that will be lost. At the end of the day, unfortunately, this lady did not have a good experience, but it is so important to have good communication with your surgeon, with your treating provider, to know what you're getting into, what the procedure is like, and what the recovery will be like at every step.